In 2001, I had an athletic accident and I ruptured 2 discs in my back simultaneously.
The major problem I came for about a year ago, it was a problem I had with the back of my leg. It just wouldn't clear up. And so that's why I thought I better come down to the Back Pain Institute to see what the problem is.
Well, I came to the Back Pain Institute because I was in excruciating pain. Been in the pain for probably about 6 months. A friend of mine at work recommended Dr. Gilbertson and the Back Pain Institute.
Here at the Back Pain Institute, we specialize in the treatment of lower back pain and neck pain.
My everyday life was, you know, the pain engulfed everything that I did. I couldn't sleep at night. I was struggling working. I couldn't do anything physically, so I needed to do something.
I had been to so many other areas and I was in excruciating pain.
I had 20 years previously I'd had back surgery. I sure didn't want to go through back surgery again.
Well, I came in and a doctor said, you know, it's a bulging disc and you need some SpineTREX treatments. He said that's the only thing that's going to do it. Adjustments would not do it.
The SpineTREX program is our program that we have developed with a number of physicians across the country over the past 10, 12 years. It actually comprises a number of elements that we have found that make the success of the program highly effective. And the number of elements consist of the decompression machine itself, evaluating the individual, nutrition, exercise, and various forms of therapy to strengthen the core muscles that support the spine.
I really had heard some negative things around surgery, so before that I wanted to try to do everything I could before I actually had somebody cut on me.
The nice thing about the SpineTREX program is that it does not involve any risk of infection or any problems that may occur in the future due to the treatment. For example, in surgery, if the surgery doesn't work, sometimes there's no way to reverse that. So the very best thing I would do, and a number of my patients have chosen to do, is to use the SpineTREX program first. And since it's highly effective, the great majority of patients that we've used it on have been able to avoid a surgery.
After about 2 weeks of the treatments, the pain began to lessen.
I had about 5 treatments initially, and it's going to start to feel good after 5 treatments.
Since we've been developing the program over the past 12 years, we have found that there are various things that need to be done in order to make the program highly effective. And our success rate is very high, and we're able to treat patients that 10, 12 years ago we weren't able to treat. SpineTREX doesn't involve any needles or any surgery. It's totally non-invasive. It's safe. There's no type of problems with infection. Okay, so it's a really safe approach to treating these problems.
The treatment procedure really shouldn't be an issue for anyone.
No, it's not painful at all, not really. It's just stretching basically, but it's more complicated than that. But no, I had no pain with it at all.
The procedure is basically a very relaxing procedure.
The results from our program have been phenomenal. We've been doing this for a number of years, and we've treated over 5,000 patients, and the majority of the patients that have been through the program are so excited that they didn't have to have surgery and that their life is back to normal.
Well, everything I did before, I do right now exactly like it was, and no difficulties with it at all.
This is not a common thing that everybody can do. As I said, I've had great experiences in this office.
Physically, I'm without pain, and you know, my life is back.
I think Dr. Gilbertson is a miracle worker.
I have my life back.
Our goal with the SpineTREX program is to restore function and to relieve the pain. Get the person back on track so that they now have a normal life without having these intermittent bouts of pain or severe bouts of pain that actually stop them from working or interfere with their life. We offer a free consultation, and this enables the individual to come in to talk to us so we can look at any studies they've had done, any x-rays, any MRIs. We can take them through a few tests, and we can help determine whether or not they're a candidate for our procedure.